Unfortunately, if we've got people with early childhood traumas, with bonding trauma, with the story of relational trauma and all complex PTSD and all what we could even imagine. Unfortunately, this group of people, they have really a little chance to integrate their personality in higher level. It means that unfortunately, in the group of people with personality disorders, we've got a lot of people who are just traumatized. But trauma, it's not personality disorder. Unfortunately, trauma, developmental trauma, could open the space for personality disorder. But it is not the same. We could have person who is really integrated. And for example, he has this experience of trauma when he is or she is older. And his or her level of personality was developed, and we could not say that he was, I don't know, borderline person. So first, not all traumas started in our adulthood, but not all started in our childhood. Second, unfortunately, that's true that 75% of our patients who come to us with all mental health issues, they started to have problems in their childhood or adolescence. Only 20-25% of people with mental health problems started to have them after 20 years old time. So it shows how our early experience really change our possibility to cope with challenges of our life. So on one hand, it is not the same. On another hand, unfortunately, it is correlated. So it is why positive psychotherapy gives us this huge chance to prevent. Because if we understand the issues and the importance of primary capabilities, then maybe we would be able to understand that if we make behavioral therapy to autistic kids without creating relationship first, then unfortunately we decrease chance for healthy emotional development of this person. If we would understand it, then maybe we would understand that if we give screens, computers, mobiles to 1 year old or 2 year old or even 5 years old kid, we unfortunately disturb development of primary capabilities and bond, and we create much more fragile structure of personality. If we know about it, then maybe we started to think that without support of mothers, we create the next generation, which are just more fragile. And then maybe we start to understand why transgenerative trauma is so difficult. Because transgenerative trauma is going via bond. And of course, in first year, at this pre-verbal stage, we could talk about bonding trauma, but usually we are rather talk about some kind of inner object and style of of bond with mother, with this the most important object in the life of this person. And this pattern is absolutely one of the most important pattern which works in during the whole life. So this transgenerative trauma is directly written inside of the personality structure of this little child. Trauma is not the same as personality disorders. But if we've got complex trauma in really very early stage of development, there is really a lower chance for healthy development. So if we do not protect development of primary capabilities, we will create the society which is fragile and who's able or to develop PTSD or just to dissociate. And this dissociation, even if it's not an active, acute areas of, mental health problems, it also creates the problems in the next generation. Because if we are dissociated from our feelings, if we live only in some part of our psyche and we are not able to see some difficult issues, maybe this little part of our psyche will be enough for us because we were developed, but it will not be enough for the next generation. And it is why, for example, in Poland, we really observe it very strongly that after secondary war, after Holocaust, after this all crazy issues, what has happened here in my country, very often second or even third generation has much more symptoms than earlier generations because of this transgenerative transfer of pain and bond and difficulties in the bond at the bond level.